Ladies and gentlemen, our program will begin in 1 minute.
A time where health...
2021, un moment où...
The past year has placed a spotlight on our health systems. While countries worked hard to contain the spread and impact of the virus, weaknesses in our national health systems were exposed. The World Health Organization reports that almost half the world's population still does not benefit from complete coverage of essential health services. But how can we strengthen our health systems in a world full of disparities? Disruptions to our ecological systems directly affect public health. But how can tackling climate change prevent worsening health outcomes? Gene editing and precision medicine can revolutionize medicine at scale. But how will the technological innovations used in recent vaccines accelerate future health solutions? We must have a global conversation. We must take into consideration all factors that affect our health ecosystem to strengthen our global health system's preparedness and capacity. Now is the time to establish a sustainable path towards more resilient and equitable health systems. Welcome to the FII Institute's UNGA side event, Health is Wealth.
Good morning, good afternoon, and welcome to the FII Institute series on Health is Wealth. We are live from beautiful New York City, where global leaders from around the world have gathered for the United Nations General Assembly. Of course, global health will be a core focus of the world leaders' discussions and negotiations, and it will also be the main topic of our discussion here today. We all know that ensuring the health of our global population and promoting well-being is absolutely vital to building prosperous societies as well as the health of our planet. And this is what we mean when we say health is wealth, this famous proverb. The prosperities of our country, our economies, our local communities, and our mother nature is dependent of our ability to improve global health outcomes. We learned from the pandemic, and what we discussed at the FII 4th edition in Riyadh in January is still extremely relevant. We are in the era of a neo-renaissance. This is why we decided to host this discussion from New York City, the capital of resilience of our humanity, with an amazing group of leaders. Today, I'm very proud to announce that the FII Institute, in partnership with Accenture and Biotech, will launch our exclusive Global Infectious Disease Index, our first index, to track ongoing outbreaks and epidemics, while assessing country health system indicators that can help contribute to the prevention, detection, and response to infectious disease threats. Finally, I'd like to highlight and to thank the large number of participants watching from around the world. We have more than 4,000 registered participants connected from 120 countries. Thank you. Last but not least, I would like to express my deepest thanks to our partners. And now, from one Richard to another, it is my pleasure to welcome to the stage my friend Richard Quest.
Richard Yasir, many thanks, and a very good morning to you from a beautiful New York City, where we're enjoying some decent weather as we get started. We have barely 20 minutes. I'm jumping straight into the discussion of revitalizing resilience and investing in health for growth. Our guests, to my left, it's David Rubenstein, the co-founder and co-chair of the Carlyle Group. And with me, of course, as well, is Todd Gibbons, the CEO of BNY Mellon here in the US. We've got 20 minutes. It's barely time to get to grips. So I need your best point in terms of investing in health. Start with you, David, bearing in mind the pandemic that we are coming out of.
The pandemic showed everybody how important health is. We obviously knew it was important, but we realized how vulnerable we still are. Despite all the modern conveniences we have in the West, we still are very vulnerable to a pandemic and other kind of health problems. So it's no doubt that if we invest in the money that we have available, we can prevent these kind of pandemics in the future. But more significantly, what we've learned is that if you're going to have a vibrant economy, you need to have a healthy population. And if you have a healthy population, your economy is going to be much, much better.
Todd.
Well, a great point. I would add to that if you look at what the drivers of health is and how clearly I won't even make the argument. Clearly, GDP is impacted by health, and I think all the data supports that. But even setting the pandemic aside, I'm a big fan of David Sinclair. He's a professor at Harvard University. And when he talks about health, he talks about 80% of it is what we do to ourselves, and 20% of it is genetic. And when you think about what we do to ourselves, and he's got great, and I'm probably doing him a disservice here, but he's got great data that supports this. There are really 4 things that matter. One is diet, exercise, getting enough sleep, and avoiding stress. We in the financial services industry can do something about number 4, avoiding stress, which probably impacts sleep as well, it might add, at least for me personally. So I think that's where we can actually really target.
Okay, well,
About getting enough sleep, I don't know if I like that one so much, because Jeff Bezos once told me in an interview he needs to get 8 hours every night. So I thought, geez, what am I doing wrong if I'm not getting 8 hours every night? Look what he's done. But it's no doubt that people should get closer to 8 hours a night and be more productive.
so the investment community, taking in mind what Todd was just saying, are the 2 that we can look at, if you like, stress and the diet, exercise, and I forgot, sleep. But where does the investment community focus its attention on?
The investment community has 3 responsibilities. One, make certain that its own employees are healthy. Second, make sure their customers are doing things that will keep them healthy. And third, make sure the population that it really serves in the community or the country it serves is also healthy. If you have healthy customers and you have a healthy population, your business will be more productive.
But you're saying that it's not that straightforward.
Well, I'm saying that the number 1 driver of stress is financial uncertainty. So I think that's one of the issues the financial services business, and certainly as an employer. I mean, I think David hit the point. What we can do, and we've learned a lot through COVID, what we can do to relieve stress for our population, for our employee population, and even our communities nearby. I mean, I've been a big proponent, for example, of financial literacy. In the United States, we do not have, our young people are not coming into the workforce with any financial literacy, any ability to handle their own their own household finances. We don't teach them about credit. We don't teach them about debt. We don't teach them about how insurance and how a credit card works. And you are 3 times more likely to be depressed if you're indebted. And so I think there are things that we can progress here.
Well, what COVID taught us more than anything else is that the world is a tale of 2 cities. If you are in a Western country like the United States, you're probably going to get a vaccine. You're probably going to have reasonable health. But if you're in an emerging market, you're probably not going to get the vaccine so readily, and you have a lot of health problems. And so to the extent we can do anything to improve productivity in the world, we've got to do more in the emerging markets.
Right, but the investment, I guess the investment money goes into where the profits are greatest. And that means the US healthcare system. It means public-private partnerships in the United Kingdom. It means the pharmaceutical industry, for example, in Europe.
Well, clearly, those are very profitable areas, but there are enormous opportunities in the emerging markets where major healthcare companies and major companies can do investments to improve the health of people there. So if the population of Africa, for example, is healthier, they're going to be better customers for products that are made by American companies.
But that's a very long term. Well, that's a very long term strategy for an industry that traditionally would think in relatively short term returns.
Yeah, but the world has recognized you can't just focus on quarterly earnings anymore. You have to focus on longer term earnings if you're going to have a sustainable company that's going to be around for the longer term, which is much better for the world.
Do you think that's true? Do you think that we have got away from the quarterly mentality?
No, I think we're still tied into a quarterly mentality. But I do think for the first time we're starting to talk much more in much more detail around sustainability. And what we've done, and COVID's a very interesting driver of this, because what we did before COVID, we talked about sustainability as infrastructure, as and around operations and things like that. But now when we talk about sustainability, we're talking about actually the resilience of our own employee base for the first time.
Now, right now, we measure companies by earnings and by PE ratios and so forth. At some point, 10 years from now or maybe sooner, each company will have an identification number that would indicate their sustainability factor, and we'll have some kind of indicator that will rate people not just on their quarterly profits, but on more important things like sustainability and what they're doing for the world's health.
So I was looking at rebalancing my 401k plan here in the United States, which is the pension system that's a defined contribution system that'll mean I'll be poor until well into my old age. But as I'm going through the prospectuses of the various funds, there is the ESG and there's the green to red. I didn't look at them. I'm only concerned with annual return. I'm only concerned. At what point will I become more interested in the ESG?
Well, the 401k investor is not the only things you have to worry about. We have other considerations as well. But at some point, you will look at this because you'll realize that if you invest in companies that are only worried about short-term quarterly profits, 1 year, 2 years, 5 years from now, your profits aren't going to be as great in your 401k.
Todd, the way we are moving forward in a post-pandemic world, and I say post-pandemic somewhat advisedly because I'm well aware that many of our viewers are living in countries where the vaccination rate are tiny compared to here in the United States. How worried are you about mental health?
Well, can I go back to
my 401k?
Back to your 401k and your investment decisions in ESG. We are seeing ESG, first of all, it's really grounded in Europe. So we're seeing huge amount of institutional, and even now we're starting to see it on the retail side, flows into ESG product. The U.S., that's happening now more quickly than you might think. Right now, the quality of the data that we've got is not that great, but we've got a particular app that crowdsources the quality of data and constantly tries to improve it. I think you're going to see GAP, applied to sustainability discussions with the same rigor around those. Right now, it's very hard to tell whether there's greenwashing or anything else. This will eventually become a very, very prominent part, even down to the retail investor, and sustainability will be a key component of that.
Younger investors than you and me are focused on ESG.
Really?
So you're not yet probably as attuned to the things that younger investors are focused on, but increasingly younger investors care more about sustainability and ESG than people your age and my age, and I'm older than you.
The focus on that, at Carlyle, what do you look at?
Well, we have an ESG team, and every time we look at buying a company, we have our ESG team do all the kind of metrics to see whether this is something that we can put our name behind, and also can we improve the ESG performance. So we don't ever go into a company now not looking at what they're already doing in ESG and what we can do to improve ESG. And that's fairly standard in our industry.
And well, can we just say, when you look at health investments in this post-pandemic or this pandemic, endemic, whatever word we use, what are you looking at now in those?
Well, we're obviously looking at how they suffered through the pandemic, but are they going to be able to sustain their profitability in a post-pandemic world? The world's changing, and people are going to function differently. And so how are all healthcare companies going to function post-pandemic? That's what everybody's looking at.
Extrapolating from that, one of the things that we've learned from COVID, and I think it will be permanent, is some of the things that we have to do to reduce stress and the mental health issues that we'll have in our workforce. I mean, some of the things that we've done is, so we built some digital apps, some virtual assessment. We got 24/7 consulting, consulting that is available to you confidentially. And I think we're going to have more innovation around daycare as well. I mean, so I had two of my children, my daughter and her husband and their two children living with us during part of the pandemic, and I can only tell you the number of balls that they were juggling to make things working from home and taking care of children. We've got to improve that. Let me add one more thing here. I think actually the future of the workplace is going to change a little bit, and I think that the stress of commuting, the cost of commuting, in a hybrid environment will be more attractive to people as well.
Well, the industrial revolution that really started in your country took about 100 years before it changed the way we live and work. Now, COVID is changing the way we live and work in just about a year and a half. It's amazing how quickly that change is occurring.
So how many employees do you have?
50,000.
So when you're talking about policies for 50,000, whether it's working from home, mental health abilities, are you aware of the titanic shifts that have taken place in the last year, in the sense of, but at the same time, you've got to continue the business of banking, and that makes profits.
Yes. Yes, no, I mean, I'm very proud of the fact that just how resilient our workforce was over a 2-week period. We had 45,000 people move from an office environment to a work from home environment, and we didn't miss a beat. We're the largest custodian in the world, and we were able to meet our clients' requirements, and it just demonstrated the resilience of our workforce. But we now need to bring it up a step. We need to bring it up a level.
That's a very important point. The people who are in the banking world, financial services, private equity, we did reasonably well during this pandemic. The people who work with their hands very often don't have the education many of our employees do. They suffered a lot. And one of the big problems we have to deal with is post-pandemic is how to pick up the people that have really fallen in the crater post-COVID and how they're going to really get back to where they were before.
That is the issue. That is the social welfare issue, whether it's social care in the United Kingdom, where the government's come up with new plans, or the Biden infrastructure and the social care plan that's being put forward. We are looking at higher taxes for the wealthy in every developed country. Do you both agree?
We are looking for them.
I think that people in Washington are looking at having higher taxes, try to get that through Congress. Whether that will get done or not, I don't know.
The terms of the public-private relationship in the provision of health care, there's a huge difference now between the US and the rest of the world, where costs have gone through the roof. It is a predominantly, even though Medicare is by far the largest single payer as such, but collectively the insurance companies are still predominant.
Well, in the United States, we have a different system than UK. Yeah. UK is probably more government-oriented than we are. We have, I think, the best healthcare in the world, but it may not be because of the system. But I do think we're going to a system where more and more of the government will be involved in our healthcare system.
I don't have anything to add.
Right. Then let's move to one thing that yesterday, the US government announced it was lifting the restriction on foreigners coming into the United States, provided they are fully vaccinated, 2 vaccinations or single vaccination if it's Johnson. This is going to exacerbate the inequity within vaccination, where most of the world is barely vaccinated.
That's true. And a lot of people in the United States are not vaccinated. We have a real political and other social issue in the United States where some people don't want to be vaccinated. And if we don't get to about 80%, we're never going to get to herd immunity. That's a big challenge we have in this country.
But even if you do get to herd immunity, it's still not going to be the answer. I mean, Israel has shown herd immunity. The UK has shown herd immunity.
It's not a perfect thing, but you're better to be vaccinated than not vaccinated. And we still have a problem that we take pride in getting the vaccines developed in less than a year, but we don't actually force people to get the vaccines.
But Todd, I'm worried that the gap between the developed and the developing world is is greater as a result of COVID. And I don't say we are sailing blithely on, because there's a lot of good words being spoken, even here in New York during the UN.
But the gap is also getting greater in the United States and other wealthy countries between those, the bottom of the sector in the United States or in UK, and the wealthier.
But that bottom is higher than the rest of the world to start with. It's, I suppose, my point. So I just wanted to get your view on, though, this idea of the difference between, or the inequality that's growing in the world at the moment?
There's no question that it's continuing. The pandemic has exacerbated it. I mean, we're even talking about healthcare. I mean, clean water in most parts of the world would go a long way to improving health. I mean, you see some of the work that Gates is doing, where he's really focused on things that you get the most direct benefit for. So there's no question that that gap is growing. Where the assets and wealth is accumulating is still in the developed world. We're seeing some of it in the developing world, but not nearly at the pace. In fact, when we talked about retirement,
Yes.
you're going to have 600 million retirees coming out of China and India in the not too distant future, and there are simply nowhere near the kind of savings that they need to have in place to support what they're going to face. That's going to be another angst over overarching. It's another mental health issue.
And if that is the case, what do we do? I mean, when I say that, I'm not suggesting you come up with a plan and say, here's 15 points, but I am suggesting that we are facing the biggest crisis in terms of retirement that we don't even understand the depths of yet.
Well, retirement ages are increasing in the United States because people don't feel they can retire at the
They
age
can't.
that they used to retire at in your country as well. But the most important point you've made, I think, is this. The concept of equality is a concept that really began in the United States to some extent. There's never been a concept around the world for most of organized history that everybody had to be treated equal. It really came from the United States, and now we're trying to make sure everybody around the world is treated equally. It's not the case, but the concept of equality is a very important concept because 300 years ago, it wasn't thought that everybody should be treated equal.
Well, yeah, but it's a concept you'd agree with.
Yeah, of course. The United States really invented this in the Declaration of Independence, but now everybody around the world is kind of focusing on how we get there, but it's not that easy to get there.
Right, but don't we have a duty to do our best to get there? Both of you. You first, sir.
Yes, absolutely. And I think there are plenty of problems in the U.S. that were reflected, not just relative to COVID, but the other racial issues and tensions that we've seen. Inequity and inequality leads to inequity, and I think that really got highlighted. And actually, and we're starting to see actions. And part of even our ESG reports, you're starting to see this come out. Some of the reporting that you're going to see from institutions like ours is going to be very specific about things that we're trying to do to make things a little more equal.
I think the vaccines are now getting disseminated in the poor countries in the world, but not as good as it should be, and there's a big challenge. The Western world developed these vaccines, but we haven't disseminated them as rapidly as we should in the emerging markets.
And where is our duty? The FII, the G7, they couldn't even get $1 billion, by the way, at the G7. They couldn't even get donations of 1 billion doses at the G7 in the summer. So where is our wealthy, privileged responsibility?
Well, we have a responsibility to help people, I think, in our own country and then in other countries as well, to get to the point where everybody is able to lead a life where they can live up to their potential and also have a healthy life. Because, if you don't have a healthy life, everything else doesn't matter. And in many parts of the world, people don't live to the 80-year-old average age we have in the United States and the Kingdom, and United Kingdom because of healthcare, lack of healthcare treatment.
But I guess what I'm trying to say, or what I understand, is we're failing, Todd. We've succeeded in getting our house in order on the vaccine in the US. And yes, you're right, there are people in the developed world who don't want it for whatever perverse reasons or legitimate reasons, either way. But we are failing the developing world.
And, I kind of go back to my first point. If you think about health, it's really around education. It's really around being, of course, it's having resources available here. We're kind of thinking after the problems evolve, but the preventative medicine is going to be is by far the most effective. And what we're learning in the data that we've got now and how we disseminate around the world to lead to better outcomes, I think there's a lot of opportunity for us here.
Well, we're doing a better job than we did 100 years ago or 200 years ago. Then the developed world didn't really care about the developing world. Now we care about it, but we haven't done as much as we should. So I think expectations are much higher of what we should do than they have been historically been. That's good, but we have a lot of work to do, but we are making progress.
Right. If we finish on this thought from each of you, bearing in mind the institutions that you lead, and how will you direct the policies of those institutions in the next 12 months towards the goal of better health?
Well, all institutions are going to make certain that their employees come back and they are healthy and they're mentally healthy and basically in a position to do the job they're supposed to do. That's the highest priority of a lot of companies. Make sure their employees come back and they're in a healthy position to work again.
Absolutely. The number one thing we're going to do is make sure that the programs that we provided our employees that assisted them with any mental health issues, the safety of the environment in which they're going to operate, those are going to be at a level that we've never seen before. That's the number one thing that we can do as an organization. And more broadly, as we provide education around financial literacy, saving for retirement, taking some of the stress away.
Richard, for your 401k, put everything in private equity. You'll be okay.
Are you offering to take it?
I don't know what we can take.
Yeah, there you are, you see. He tantalizes. And then
there are a lot of good private equity firms, but...
I'll take that as a yes and maybe and talk about it later.
All right.
Thank you very much, gentlemen. I appreciate it. Thank you very much indeed.
Thank you, Richard.
As we now move forward, it is now my pleasure to welcome to the stage Professor Jose Manuel Barroso. He's the board chair of Gavi. He was also, of course, the European Commission president during some very difficult times. Now as Gavi, the Vaccine Alliance, he is very well versed in the issues facing what's happening today with the pandemic.
Ladies and gentlemen, I'm delighted to join you today for this very important and highly topical issue. With nearly 250 million people infected, more than 4.6 million deaths, and ongoing devastation to economies, this global health crisis continues to rage on. Given that there are now COVID-19 vaccines available, why is that? The principal reason is the huge disparity in global access to these vaccines. In a globalized world such as ours, the very nature of infectious disease means that until people in all corners of the world are protected, this virus will continue to circulate, and new and potentially more dangerous variants like Delta variant will emerge. That puts everyone at risk, including those fully vaccinated. Yet 10 months after the first COVID vaccines were approved, we are still a long way from that. Less than 2% of people in low-income countries have received their first shot, compared to 66% or more of people in the wealthiest nations. This appalling and unacceptable disparity urgently needs to be rectified. But sadly, we should not be surprised. Huge gaps in global health existed long before this pandemic. COVID has shone the spotlight on these inequalities and in many ways has amplified them. However, with COVID-19, we have a global solution in COVAX, which was created last year precisely to make equitable access to these vaccines possible. So far, COVAX has delivered around 300 million doses to people in 141 countries, the majority of whom would otherwise struggle to get them. COVAX has shown that it can deliver vaccines anywhere in the world. But why couldn't it do more? Because we had no doses, because there were export restrictions, because some countries were accumulating too many doses that indeed they did not need for their own population, and also because there were some problems of supply and some bottlenecks in production. But now, as COVAX supplies ramp up, and it works to deliver 1.4 billion doses by the end of the year, the message that no one is safe until everyone is safe is finally starting sinking in. As the pandemic persists, governments are recognizing that the only way out of this crisis is by addressing these global disparities. And so as we start to see governments no longer focus solely on their domestic response, but also looking to global solutions. And they are now beginning to throw their full weight behind COVAX, which means we have an opportunity, not just an opportunity to end this pandemic, but an opportunity that can help bridge these long-standing health gaps. The potential benefits of doing so are huge. Not only will it help bring us closer to the Sustainable Development Goal of universal health coverage, but it will also increase the chances that we never have to face a global health crisis on this scale again, by helping to improve pandemic preparedness. So what is the solution now if you want to end this pandemic? As co-lead of COVAX, Gavi has a central role to play there too, helping to make what is effectively the largest and most complex global vaccine ever a reality. And that's what we are doing. Wealthy governments can help get us there quicker by donating more doses to COVAX, making them available immediately, or by giving up their place in the supply line so COVAX and lower-income economies can access these doses quicker. This could help save the global economy $2.3 trillion according to the IMF. Manufacturers also have a role to play by ensuring greater transparency on their order books and delivery timelines, by creating a more level playing field to ensure that they don't put profit ahead of ending the pandemic, waiving requirements for indemnification for the humanitarian buffer as well. By providing millions of COVID-19 doses to people in the 92 lower-income economies that would otherwise not be able to afford them, the Gavi COVAX Advanced Market Commitment is the only truly global solution to equitable access. But to do that, it needs global support. That is the only way to bridge any global health gap. I believe we will do it, but for that, we need this commitment to solidarity. I thank you.
Hello, my name is Jane Witherspoon, Bureau Chief at Euronews Dubai. I'm honoured to be here to MC this thought-provoking event, and we're very pleased to see that viewers are joining us from 78 countries. Welcome again. Health is Wealth addresses the pressing issues of today, the future of health, pandemic responses, biotechnology, and much, much more. Thanks to Professor Barroso for that thought-provoking session, looking at vaccine inequality, the problem and the solution, a very hot, debatable topic in the world we now live in. Next, we have a very special conversation with a world leader, His Excellency Felix Antoine Tshisekedi Tshilombo, President of the Democratic Republic of the Congo. And to moderate, our very own Richard Attias, CEO of the FII Institute.
Mr. President, thank you very much for giving us some time during this very busy week during the UNGA. You are here as President of the Democratic Republic of Congo and President of the African Union. Following these two titles, I would like to ask you a few questions on this terrible pandemic of COVID-19 and to understand the situation of the African continent. What can we do to rectify Africa's critical vaccine shortage that we hear a lot about, especially when it comes to the unequal access of health technology? I know this is one of your greatest fights today. Thank you very much, Richard. Allow me first to thank the organizers of the FII Institute to have called me and to join this high-level discussions and to talk about this vaccination that is of high importance in the world. It is indeed one of the main pillars of my action plan for the African Union. I would like to also salute the leadership of Monsieur Yasir Al-Rumayyan, the president of the FII Council, when it came to mobilizing resources and partnerships, as well as private and public partnerships, when it came to public health and economic growth. In the name of the African Union that I represent here today, I would like to thank you warmly. As you said it, according to the world, Africa is late. And it can be very worrying, especially when it comes to vaccinating our population against the COVID-19. Over 5 million doses of vaccination have been distributed in the world. The statistics in Africa only represent the fact that Africa, with a population of 1.3 billion inhabitants, we have only benefited of 100 million doses, which is very unequal and very weak because it only represents 3% of the population that is vaccinated today. Indeed, we can note here that there are improvements when it comes to health coverage across the continent. Today, in Africa, we know that we have been able to vaccinate 39 million people in Africa, equal to 1% of the world population. Now, this sad realization only pushes us to find new ways in order to face the unequal or the scarcity of these vaccinations. Now, in my opinion, this vaccination against COVID-19 must be a common good, must be distributed equally to the world and remain accessible to the entire population. And the rich countries have the obligation, the moral obligation, to transfer the technologies and lift all patents that hold us from using it. Everyone needs to be able to have access to it, and it's the only way we can manage global immunity and help the planet Earth. The second channel, when it comes to the African Union, I think we need to reinforce the current dispositions in place, the infrastructures that currently exist. We initiated the COVAX mechanism that allows all the countries of the continent to access the vaccination against COVID. We are currently working with the World Health Organization and Gavi to put in place the special fund of vaccine acquisitions, AVAT, equally, and there is a major initiative to develop local production of vaccinations in Africa. And for the African Union, we hope to have at least 60% of our population, 60% of vaccination circulating in Africa, while today the production is only at 1%. The third channel of thought for each country of the African Union, we have strongly encouraged each country to develop strong national strategies and vaccination campaigns. Certain countries like Morocco, South Africa, or Botswana have accomplished incredible progress. But the 33 African countries that are still slowing down cannot have access to these vaccinations, especially if you count on their national public resources. In this regard, I'm calling upon your help so that everyone can have access to these vaccinations, especially through this international fund, and that would allow to activate and allow these vaccinations to be accessible for countries that are not as developed. Now, all the foundations and the donators, the stakeholders should also do the same. What I understand, Mr. President, is that the vaccination must be a public good. It must be accessible to the world. And I think that this calling is very important. It's a New York calling that you are making, and I hope it will be heard. The economy has been very affected. The world economy and African economy especially has been very affected by the pandemic. Now, how can the reinforcing of the health system in Africa can have an impact on regrowing the economy? In Africa, the pandemic has had a very strong impact on the economy. It is true. This has driven the entire continent in the worst recession in its history. This shock has caused incredible difficulties in the entire economic system. We had millions of loss of employment that has increased the poverty of our country. We have recorded 2.1% of the GDP, so a slowdown of the economy, and especially social and security difficulties. Now, the vaccination, access to the vaccination could avoid a third wave. But this could help us on the short term and long term for the entire countries, as much for the rich countries and the poor countries. The main condition for this economy to be recovered is vaccination for everyone. There's no miracle question. There is no other solution. And we need to reinforce the public health system in Africa, which is quite weak. This must be through the green growth and the rule of law and the green economy. These are the three solutions we are looking at. Now, to bounce back on what you just said, Mr. President, how can Africa leverage its unique multilateral institutions and its biggest wealth, which is its human capacity, in order to build a stronger future and a future more serene? Now, despite the negative economic impact of this COVID-19 pandemic, Africa has demonstrated strong resilience. And today, we have everything to be able to bounce back economically. The economic plan is existing since 2013. It is the roadmap for a prosperous future in Africa. It's a peaceful future, an integrated future, like the one that we call the 2063 agenda. And this agenda recalls a lot of different things. It's the demographic, the energy, respecting the environment, modernization of different infrastructures, and the consolidation of peace and security, which for us is essential, without which nothing else would be possible. And to face all the different African challenges, there is the creation of the free trade, which is a common market that brings together over 1 billion inhabitants and 1 billion consumers. And this will help Africa develop its trade and allow it to be promising. Trade will be the vector of the structural transformation of the country, and especially when it comes to industrialization, diversification, and creation of employments and sustainable employment, thanks to the development of small and medium enterprises. Only then will the youth be able to enjoy of a new rebound of economy. You know that Africa has a majority of youngsters. Women will also play a very important role in this economic growth because they are an asset to human capacity when it comes to trade in Africa. We definitely need to invest in education and training of these youngsters, and especially in taking responsibility and empowerment of women. And I call upon the international solidarity to fill in the gap of these of the financing of these different works, because the foundations are called to interact with the African Union in order to ensure the sustainability of the African Union funds in order to fight COVID-19 pandemic. Thank you very much, Mr. President. Rest assured that the Foundation and our institute will always be by your side and will always support you. Thanks to your leadership, I am convinced that this resilience that you have evoked and the energy that we can feel on the African continent will be part of the solution. And I find it extraordinary to see this strong morale that you maintain in Africa. And I know that this is one of your values that you have shared and transmitted. Thank you very much for your presence and for sharing your ideas with us. And I hope to welcome you again very soon. Thank you for the invitation.
Thanks, Richard, who was joined there by His Excellency President of the Democratic Republic of the Congo. Now we will shortly be crossing over to our moderator, Anthony Barclay, PhD, Director of ACT and Head of Investments for the FII Institute, for a panel titled One Vaccine, Infinite Potential. Joining him, Dr. Mel Spigelman, President and Chief Executive Officer, TB Alliance in the United States, and Dr. Özlem Türeci, Chief Medical Officer, Biotech in Germany, someone who's helped lead the development of mRNA-based vaccine and cancer antigens, as well as individualized immunotherapies in clinical development.
Hello from Central Park here in Manhattan. I'm joined by two of my heroes in the fight against disease and the fight for a healthy planet. All of us have watched with increasing confidence and optimism the ability of our leading researchers globally to create a solution for the COVID-19 pandemic. And today, we have a wonderful opportunity to learn a little bit more about that successful fight and draw some lessons in the fight against other medical challenges. Dr. Özlem Türeci, you are truly a hero of mine. Thank you so much for joining us virtually. We have all watched as you and your team at Biotech have developed one of the leading vaccines in the fight against COVID in record time, the Pfizer-BioNTech vaccine. What lessons, what secrets do you have for us that you can apply from that experience to other diseases and other challenges that we face?
Thank you, first of all, Anthony, for your very kind words and for this opportunity to be here today. There are, in fact, a couple of lessons we have learned from the COVID-19 exercise. We originally, many years ago, have chosen mRNA as our vaccine technology because we believed deeply in its potential to democratize healthcare. And the COVID-19 pandemic has been a baptism of fire, which forced us with this technology to accelerate some of those steps towards this vision. And there were two major learnings, in fact. One learning was that public-private cooperation is very important, in particular if you come with a new technology which potentially might be transformative. It's very important that public-private cooperation on all levels, meaning between academics and companies, meaning between regulators and developers and policymakers, is very tight and starts from the beginning. This was something which was achieved in this pandemic when we were developing our vaccine and has been a key success factor. And another learning is that it's very important not only to have technology, but also invest into the science of understanding the disease you want to treat, in this case, the biology of this new virus, and into understanding of the immune system and the way in which the scientific community has cooperated and shared data was also a key success factor.
Thank you, Doctor. Dr. Mel Spigelman, you know the painful truth. As Chief Executive Officer of the Global Alliance in the Fight Against TB, a disease like TB today kills 1.5 million people. And there are other diseases as well that maintain this incredible threat to humanity. What have we learned from Dr. Türeci and others in the fight against COVID that can be applied to these other struggles in managing a disease like tuberculosis, or even eventually preventing it and eradicating it?
Yeah, no, thank you very much. And obviously thank you to the sponsors of this event, which is unbelievably important. I totally second everything that we just heard. These are so crucial points that we have known for many years, frankly. We are a public-private partnership, and that's the only way that we can work. I think the point that really the COVID-19 pandemic has proven is that the fight against diseases requires significant investment.
Yeah.
That in addition to the partnerships, in addition to the health system strengthening, in addition to all of these other factors, there has to be miraculously transformative, and we've seen it. When successful, it's unbelievable what scientific advances can do. But it requires significant investment. And unfortunately, while that investment, to be very frank, is frequently there when the diseases primarily or significantly affect high-income countries, that investment is simply not there. When the diseases are primarily diseases of poverty, like TB, or primarily affect the poor of the poor around the world, even when, like you say, the disease kills 1.5 million people every year. Ironically, TB was the largest infectious disease killer in the world until COVID came along. And my prediction would be COVID will get better in that sense, but TB has already been set back 5 to 10 years in terms of progress against TB because of all of the even decreases in resources.
Dr. Turecci, let me put you on the spot. Your success has raised our aspirations of what we can expect in the fight against disease. Are there other diseases in your research agenda or other diseases that you're tracking that you think we can expect to see foundational progress in the fight against within, say, the next 12 months to 18 months?
We are also very interested in using what we have learned, not only technologically, but in terms of drug development processes to other infectious diseases. And we started with this actually prior to COVID. This includes tuberculosis and HIV and also malaria most recently. What we have learned about our platform has now the potential to accelerate all those programs. And for example, our malaria program is one where we expect to see first milestones within the next 12 to 18 months. And I also expect this for our tuberculosis program.
Thank you. Dr. Spigelman, why are you optimistic that we're on the verge of making this kind of progress against TB?
Well, I'm both optimistic and pessimistic, to be very honest. I'm optimistic because with relatively scant resources, we have already made huge progress. Just to give you one example, we just recently introduced a new treatment for extensively the most resistant cases of TB that brought treatment from 2 years down to 6 months, raised cure rates from 30% to 90%, decreased the cost, et cetera. And so the science is fantastic. And even with modest resources that we have been able to make significant resources in conjunction with a variety of partnerships. However, I'm also pessimistic because the progress we've made pales in comparison to the problem. And therefore, unless there really are significant more resources, frankly, brought to bear on the problem, then I venture to say that it will take decades to perhaps centuries to actually see, ultimately, actually, the eradication of TB, which is the goal.
Not so long ago, here on Wall Street, pharmaceutical companies were punished by analysts for maintaining active vaccine development programs because they weren't viewed as lucrative business segments. That has changed, and that has changed fast. And so that gives me confidence, as I listen to both of you, that the basic human values of trust, commitment, belief, and partnership, combined with the science of messenger RNA and other techniques, with this renewed enthusiasm and attention for solving humanity's basic problems in a program like vaccine development, and then rewarding the companies that allocate their resources to do it. That's today's Wall Street. That change has happened so fast that I think all of us here watching your great work have greater optimism and greater confidence that progress will be accelerated. And I want to thank both of you. It is truly your lessons and your leadership that is driving this forward and making this progress possible. So thank you.
Thank you.
Thank you. Thank you very much.
Our next session will look at health in the Anthropocene. I'd like to pass you to a remarkable woman, Dr. Jane Goodall, Dame of the British Empire, founder of the Jane Goodall Institute and UN Messenger of Peace for the United Kingdom. Someone who's devoted her career to primatological research and one of the world's foremost speakers on conservation, environmental and humanitarian programs.
First, let me thank you for inviting me to say a few words about the most important topic of our time, the relationship between human health and well-being and the health of our planet. From my years of studying our closest living relatives, the chimpanzees, it became clear that the thing that separates us most from them and all other animals is the explosive development of our intellect. Yet, despite this, we are destroying our only home. We make decisions that lead to short-term gain at the expense of protecting the environment for future generations, embracing the absurd idea there can be unlimited economic development on a planet with finite natural resources and growing populations of humans and livestock. The unsustainable lifestyle of the affluent places unsustainable demands on diminishing natural resources. Poorer people destroy the environment in their desperation to make a living to feed their families. Giant corporations compete to produce ever cheaper produce to increase their consumer base, disregarding the suffering of animals and their workers alike. Products are designed to become obsolete so that they must be replaced. We've polluted air, land, and water. We're moving further into wildlife habitats in our endless quest to plunder Earth's natural resources for our own need or greed. For years, we've disrespected nature, and this has led to climate change, loss of biodiversity, and the emergence of ever more zoonotic diseases, including the current pandemic. By penetrating deeper into wildlife habitats and by exploiting wild and domestic animals, we create conditions that enable pathogens to spill over from animals to people. Scientists studying these zoonotic diseases have been warning us of the inevitability of pandemic, such as COVID-19, for years. Alas, we didn't listen. We're all affected, but poor communities suffer most. And there's something else. We depend on the natural world for clean air, water, food, everything. But we depend on healthy ecosystems in which the interrelated plant and animal species all have a role to play, creating a living tapestry. And each time a species becomes extinct, it's as though a thread is pulled from the tapestry until it hangs in tatters. The ecosystem collapses, and human livelihoods and health are compromised. Climate change, due to the greenhouse gases that have proliferated since the Industrial Revolution, is having a devastating effect everywhere, with hurricanes, floods, droughts, heat waves, fires, and rising sea levels. It's harming all of us, but again, it's poor communities that suffer most. Only too often they're forced to work in dangerous and unhealthy conditions to support their families. Environmental disaster is driving millions of them to seek a livelihood away from a home no longer habitable. We must wake up. We must develop a new respectful relationship with the natural world. Our health and well-being clearly depends on a healthy environment. We must protect and restore the natural world, ban factory farms, wildlife markets, and animal trafficking. Stop the horrendous overuse of toxic pesticides, herbicides, and artificial fertilizer that's killing the soil. Revert to organic, regenerative farming, permaculture, and small family farms. We can plant and care for trees and help those who are protecting and restoring forests and other habitats. We can fight for urban tree planting. We can move towards a plant-based diet. Make renewable energy from sun, wind, and tide cheaper and more efficient. Reduce the enormous amount of waste that we create. The wealthy waste food whilst the poor starve. We must ramp up recycling efforts and move towards a circular economy. We must introduce environmental and humanitarian education in all school curriculums and encourage children to connect with nature. Finally, we must remember that each one of us matters, has a role to play, and makes some impact on the planet every day. And we can choose what sort of impact we make. Millions of small ethical choices in how we live, made by millions of people around the globe, moves us towards a better world. We know what we need to do. The only question is, do we have the strength and courage and will to take action? If we care about our grandchildren and theirs, if we care about our tiny planet home, surrounded by the black immensity of space, then we can save it. Indeed, we must, before it's too late. Thank you.
Thank you to the incredible Dr. Jane Goodall. Next, we're joined in a special conversation with His Excellency Yasir Al-Rumayyan, Governor of the Public Investment Fund, Chairman of Saudi Aramco's Board of Directors, and Chairman of the FII Institute, Saudi Arabia. And to moderate, we have David M. Rubenstein, co-founder and co-chairman of the Carlyle Group in the United States, one of the world's largest private investment firms.
Today to have the governor of the PIF fund, which is one of the largest sovereign wealth funds in the world, Yasir Al-Rumayyan. Thank you very much for spending time with us today.
Thank you.
So you've now been the governor of the PIF fund for about 6 years. And during that period of time, the word sustainability has become much more important in the world than it was maybe 6 years ago. Why is sustainability so important to the PIF fund?
Actually, we've been looking into the sustainability for a long time. And I'm talking about Saudi Arabia, I'm talking about Saudi Aramco, and I'm talking also about PIF. So I'll start with Saudi Arabia. His Royal Highness, the Minister of Energy, announced, I think this year, that by the year 2032, we will have 50% of our energy from renewable energy. And 70% of that will be through PIF and its portfolio companies. We have Aqua Power, which is one of the largest solar power installation company in the world. And we own like 50% of that company. We want to grow it to new levels. Also, it's not only the sustainability coming from the solar panels and the solar energy, but also from different types of things that could have less impact on the environment. Today, we are one of the largest oil producers in the world. Saudi Aramco is the largest company in the world when it comes to producing oil. But at the same time, this production of oil is much better than, if you want to compare it with the others, when it comes to the emission, the carbon dioxide emission, and when it comes to the ethane intensity.
So let me ask you this. For people that are outside of the Kingdom of Saudi Arabia, for example, or maybe outside of the Gulf, they would say, well, why does Saudi Arabia care about sustainability? Why not just produce as much oil as you can and maximize the dollars you get out of this and forget sustainability, just make the most money you can? Why do you care about sustainability?
Two things. One, if you look at our population today, almost 70% of our population, we have 33 million people residing in Saudi Arabia, are under the age of 35. So we really want to think about the future generation. Health is wealth. That's, I mean, part of our slogan for the FII virtual forum today. And we think you cannot separate health from economies and from sustainabilities. So we're thinking of the future generations of Saudi Arabia. So that's one. Number two, we are one of the most efficient when it comes to sustainability and renewable energy. So today, as I said, our solar power production is costing us only 1.2 cents per kilowatt hour, versus some other jurisdictions, it's over 15 cents. So we think oil is a scarcity, and maybe we should use it in a better place, like the crude to chemical, which is would have zero emission, and at the same time we will have more impact there in our supply chain and many other things.
Okay, let's suppose you are a role model for sustainability in the Gulf and maybe even other parts of the world. Why should other countries say, well, look what Saudi Arabia is doing, we should follow suit? Now, is it your goal to have other countries say, we should follow the Saudi leadership and be more sustainable than we are? Because if the Saudis are sustainable, given all the oil they have, we have to do it as well.
I totally agree. If you look at most of the initiatives around the world, the global ones, like the World Bank and the oil and gas group of companies, we are always below the target, the future targets. And we've been below these future targets many years ago. Now, we've done it, as I said, not a year ago or 6 years ago. We've been doing this for many decades because we think more sustainable is, we have long-term views. We don't want to exploit all of our resources overnight, or 1 year or 2 years or 3 years. I think in the longer term, you will benefit. Not only Saudi Arabia, I'm talking about any other oil and gas company, I'm talking about any other country in the world.
Now, you've announced that you are supporting and helping to build a fully sustainable city, a zero-emission city, the future city of Niam. How is that progressing? Is that going to open sometime in the near future? And is it going to be more of a complicated problem to make that work than you once thought, or is it actually going to be easier than you once thought?
It was announced by the Crown Prince early this year that we will start the groundbreaking on the line, hopefully this year. We're at the very final stages of the planning. Some parts of the NEOM company is already started with construction. I'll give an example, Sandala Island, which is going to have a lot of resorts and golf courses and other stuff. But the line we're hoping we'll finalize all the plans before the end of the year. And we will start construction before the end of this year. Now, you mentioned about the sustainability there. It's going to be zero carbon emission. It will have no cars, actually. It will be about 170 kilometers of basically a line, and it's going to be 30% more efficient. And when I say efficient cost, I'm talking about the cost efficiency.
Now, during the last 18 months, the world has suffered from the pandemic, and it has affected all countries in the world, and obviously it brought home to everybody how vulnerable we are health-wise. In the Kingdom of Saudi Arabia, what did you do with your employees at PIF and Saudi Aramco? Did you have them working remotely, or did they work in the offices with masks? How did that work?
We started like most of the other countries. Actually, we were a bit ahead of most of the other countries. So we had a total lockdown initially for a few months. Then we started gradually by putting only 25% of the workforce in the offices. Then we moved it to 50%, 75%. Today, it's 100%. And if you look at the vaccination rate today in Saudi Arabia, it's about 70%, which is really great. 2 jabs, 70%. The daily cases that we have is going to all-time low, maybe 80 cases a few days ago for the whole Kingdom of Saudi Arabia. I'm not talking about one city or one district.
So how does health relate to sustainability? In other words, if people are healthy, are they going to have a more sustainable lifestyle? And what is the relationship between health and sustainability?
I mean, as I said, it's most of our population is really young, right? So we want to take care of their health, and the sustainability is improving the well-being of all humans. We want to start in our country, the region, and the world. Potentially. I mean, if you look at some of our portfolio companies, they're working like in many different countries in the world, trying to install PV and solars and stuff of that nature. I think on the 23rd of October, Saudi Arabia will announce its green initiative, and followed by the Middle East Green Initiative, whereby we will be planting 50 billion trees in the Middle East. 10 billion will be planted in Saudi Arabia. Now, some people would say, you know, where would you get the water from? Mainly, it's going to be mangroves. Mangroves, as you know, it doesn't need fresh water. It needs the seawater, and its carbon capture capacity is like 5 to 6 times any other tree.
Let's suppose somebody comes to PIF and they say, I'd like to get money from the PIF to invest in my company. I don't really care about sustainability, but we're very, very profitable, and we're going to make a lot of money for PIF. But sustainability is not our thing. Will you say we'll invest with them, or will you say without sustainability features, we're not going to invest?
We started many initiatives. The FII is the first one with the sustainability. Now we're working with BlackRock to put a ESG, basically, framework. And of course, part of it is the sustainability. And we're working with many partners from all over the world, domestically and internationally, to have a better ESG compliance to all the things that we do. The FII Institute is now working on ranking and rating the rating agencies, because the problem that we've seen over the past years since the starting of the ESG is the inconsistencies between rating from different institutions. So we need to standardize this. And we're working in PIF, in Saudi Arabia, and the FII Institute to try to put the right framework for it.
So when someone comes to PIF for investments in the future, and maybe now, They have to say what their ESG compliance is and what their standards are on ESG and sustainability, not just with the rate of return they're going to get.
We'll go on there gradually. I mean, one of the things that we will be announcing very soon is our green issuance. And in fact, there was some news here and there about it, but it's going to be out very soon. And we will be the first sovereign wealth fund in the world to announce this green issuance.
So Saudi...
Some of our portfolio companies already did. Red Sea company already had a green issuance of $3.7 billion.
So when Saudi Arabia is a big exporter of oil and has been for many years, you hope to be a big exporter of sustainability practices and ESG practices as well?
Definitely. And we need to make it sustainable and efficient at the same time. Our oil is the best when it comes to the emission. We are 50% if you want to compare us to the industry. If you want to take us out of the industry average, we will be at 70% less emission than the other companies. I want to see this in all the oil companies, not only us.
So when you're the head of PIF, I assume everybody you meet has a great investment opportunity. So can you ever go anywhere where somebody doesn't say to you, I have a great investment opportunity? Has that ever happened?
I haven't seen that yet. I'm looking forward for that day.
All right, so everybody's always telling you their opportunity is the best.
Absolutely.
Okay. Well, Yasir, I want to thank you for a very interesting conversation on sustainability, and congratulations on the progress you've made on sustainability at PIF and at Saudi Aramco.
Thank you very much. Always good to see you.
Thank you.
Thanks to our esteemed guests for that intriguing chat. Up next, we have a special announcement from the Infectious Disease Index.
Thank you for the introduction, Jane. Your Excellencies, ladies and gentlemen, welcome to the Health is Wealth event by the Future Investment Initiative Institute. As you know, health has become a very prominent priority for our world. We witnessed this last year from the beginning of the COVID-19 pandemic. Its impact on our world was unprecedented, with millions dying amongst catastrophic economic devastation. Health is one of the 4 main priorities of the FII Institute that carries great importance for us. It's in this reason that earlier this year, we developed our health strategy, which is linked directly to SDG 3, and more specifically, infectious diseases. In this connection, our first paper called for the world to invest in a global vaccine to tackle TB. TB is a disease that kills 1 person every 20 seconds, which will cost the globe over $16 trillion by 2050 if it isn't eradicated. However, for us, just releasing a paper was not enough. In our research, we noticed that one of the reasons that COVID spread so fast was because of the lack of data. We then decided to develop a unique tool that captures both endemic and epidemic diseases. For example, our tool also reflects the readiness and the vulnerability of country systems in terms of medical staff, beds, and percentage of population with basic immunization. In this way, the data will inform health ministries worldwide about the gaps that need to be filled to tackle endemic and emerging epidemics. After several months of deliberation and working with like-minded partners, we arrived at the Global Infectious Disease Index. The index showcases dual impact of the endemic disease burden and epidemic disease threats across 204 countries and territories. The endemic component of the index showcases the burden from 5 global endemic diseases. I think we all know what they are by now. We have HIV, malaria, TB, lower respiratory diseases, and diarrheal diseases. Captured in near real time, the endemic component tracks up to 60 pathogens, which may pose a potential threat to the globe. The index provides an objective, quantitative, and comparable measure for infectious diseases, thereby enhancing the situational awareness to effectively prepare, respond, and mitigate global health threats. Now, ladies and gentlemen, as a Dane, I would like to take you to Denmark, where I would like to showcase you the level of endemic diseases and display that to you on our index. The number 7 leading cause of death in Denmark is linked to lower respiratory diseases, where last year 2,118 people died from pneumonia-related illnesses. As you can see from our overview, lower respiratory infections are marked as being high in Denmark. For the next example, I'd like to take you to a different country that's based on a completely different continent. I'd like to take you to Malawi. Now, in Malawi, I'd like to show you some data about the endemic disease, which is malaria. Here you can see that the number of medical and support staff is only 0.5, and this can give us an indication of the burden of dealing with malaria, which is quite high in the country. This will allow us to explore further how we can inform governments on, for example, the recruitment of medical staff that will eventually help reduce the burden of the disease. And finally, as something very unique to our platform, we have also included the following 6 rankings: number of medical staff, number of hospital beds, health expenditure, population with basic immunization, population with basic access to water, population with basic access to sanitation. In closing, Your Excellencies, ladies and gentlemen, due to the pressure of time, we'd like to invite you to join us at the FII 5th edition in October, where we'll be spending more time in showcasing our index, its findings, additional releases, and future scope that goes beyond the data. I wish you all a fruitful morning with what promises to be a very exciting agenda. Thank you.
Thank you so much, Safiye, for sharing that exciting launch of the FII Institute's Infectious Disease Index. It's great to see we've now got viewers joining us from 85 countries. Thank you and welcome. Next up, we have Bashara Shauker, Vaccination Coordinator of the White House COVID-19 response team in the United States, the man responsible for overseeing the national vaccination efforts under the Biden-Harris administration.
It's a pleasure to join you all virtually from the White House this morning. In my remarks about vaccine distribution for all, I'll cover 2 things. First, how governments and the private sector should work together to ensure vaccine access to all residents. And second, how leaders can leverage the lessons from the COVID-19 response to strengthen health systems and pandemic responses for the future. We all know these are critical topics. Vaccines are our most important tool to protecting ourselves and our loved ones from this pandemic and from future pandemics. They are enabling us to spend more time face-to-face, go back to school, eat safely at our favorite restaurants, and return to work with our colleagues. They're making our economies to keep moving, and they're allowing us to hug our loved ones without fear. We have to ensure vaccines are widely available. So I'll start there on vaccine access and on vaccine equity. This has been our priority from day one of the Biden-Harris administration. When we came into office, we set 2 objectives: get shots in arms as quickly as possible and do so as equitably as possible. And as a country, we leverage partnerships between the federal government, state, and local governments, the public health community, health systems to pursue these goals. We've provided billions of dollars in government funds to state and local governments so that they could stand up their own vaccination clinics. We've helped tens of thousands of local hospitals, doctors' offices, and health clinics to do the same with funding and technical assistance. We stood up high-throughput mass vaccination clinics nationwide. We shipped vaccines directly to tens of thousands of pharmacy stores and to community health centers, which provide health care to our most underserved communities. Vaccinations were being administered incredibly quickly in the first 4 to 5 months, and the partnership between government and healthcare providers was driving remarkable results. By the end of May, almost 175 million people have received one shot. But even as we prioritize our initiatives to promote vaccine equity, racial and ethnic vaccine disparities persisted. So in those months leading up to and after May, our pandemic response transformed from an all-of-government response to more of an all-of-society response, which also activated businesses, community organization, faith-based organization, public health leaders, and inspiring figures. And we've doubled down on efforts to activate local doctors nationwide, communities and patients people know and trust. And let me give you some example. To improve access and make it even easier for everyone to get vaccinated, we made sure there was a vaccination site within 5 miles of 90% of people living in the US. We've deployed tens of thousands of pop-up vaccination sites at community and faith-based organizations, at schools, at business sites, sporting events and barbershops. Uber and Lyft offered free rides to and from vaccination sites. Childcare was offered for free to watch kids while parents got their shot, which was important in low-income communities. And we asked businesses to offer paid time off for all individuals to get vaccinated. Second, we placed a huge premium on building confidence in the vaccine by launching a nationwide grassroots network of local voices and trusted community leaders to encourage people to get vaccinated. We rolled out public ad campaign about the vaccine and elevated trusted physicians and community leaders as vaccine ambassadors on local radio and TV. And we've deployed billions in funding to support local community efforts to educate about vaccines. And third, and most recently, we have encouraged and facilitated vaccine requirements for US government employees, for healthcare workers, and for companies with more than 100 employees. These vaccine requirements cover over 100 million workers in the US. And our definition of all society expands beyond our borders because we know this virus doesn't respect any boundaries. That's why we continue to support global efforts. We're proud to have donated nearly 150 million vaccines to over 90 countries, more than all other countries combined. And we've started to ship another 500 million with vaccines purchased to donate to 100 lower income countries in need of vaccine. So what did we learn to leverage the lessons here to strengthen our healthcare systems and our pandemic responses of the future? Our public health infrastructure has been overstretched. Our data systems for disease monitoring and sequences need to be improved. Historical health inequities in our country have been exacerbated in many ways. And we've already made significant investments to address these issues. Billions of dollars to hire and train public health workers. We're building genomic epidemiology infrastructure to prevent and respond to future biological threats, including supporting cutting-edge research into genomic epidemiology, and building a national bioinformatics infrastructure to create a unified system for sharing and analyzing sequence data to enable informed decision-making. And on top of this, we have, of course, made historic investments in enhancing and securing supply chain in vaccines, PPE, ventilators, testing, and pharmaceuticals. Importantly, we've put our money where our mouths are, and I think it is an important lesson for all of us on a global scale. We want to ensure positive health outcomes in the long term and not be flat-footed when the next pandemic comes, which it will. So I'll wrap with this. I believe we have the tools to end this pandemic. Now we just have to finish the job with truth, with science, with resources, with confidence, and most importantly, together as a global community. Thank you so much for having me here today.
Next, how do we balance the scales of global health? How do we ease the health gap? Well, let's find out. Over now to Richard Quest, anchor, correspondent, and CNN business editor-at-large, CNN in the United States, who will moderate this exciting session following the next video.
Welcome back to New York. The White House vaccine czar did a very good job of telling us how big the problem was, and an element of self-congratulation about actually how far they'd done. The next three guests, the challenge is going to be to get them to say what needs to be done, because they're all going to agree on the awfulness of the current situation. The issue is how to improve it. These are three of the world's most prominent experts in this. First of all, Dr. Akinwumi Adesina, the president of the African Development Bank Group, who joins us remotely. Dr. Akin, can you hear me first? Let's test the connection.
Yes, I was having difficulty hearing you, but I can hear you now. How are you, Richard? How are you,
I'm very well,
Cigars, Jim?
Right, well, Jim is Jim Yong Kim, the former World Bank president and the partner and vice chairman of Global Infrastructure Partners. You are, sir, a global expert on infectious disease management from a public policy point of view. The right man at the right place at the World Bank during Ebola, and we'll find out what you think needs to be done. And Dr. Ngozi Okonjo-Iweala, who is a health expert, a finance expert, a trade expert, and one of those people that we call in when we need something done. Ngozi, who's now the head of the Director General of the World Trade Organization. So let's start with you, Ngozi. It's very easy to say something must be done, but the disparity of the numbers we saw, 80% first vaccine or one dose, 20% in emerging markets, and that really doesn't tell the whole story for those countries that virtually have no vaccination. What needs to be done?
Let me talk about two things, in the short term and then quickly for the longer term. In the short term, we must get those countries that have an excess of vaccines. Some countries have acquired 2 or 3 times what they need for their population, to donate those vaccines to COVAX, the facility developed to help poor countries, so that they can send them to where they're needed. They should also swap places. Some of them have ordered vaccines and they are at the head of the queue. We need them to swap places with countries that are behind, poorer countries, so that they can get a chance to get the vaccines. That's short term. In the longer term, manufacturing. We have to decentralize manufacturing in the world. 80% of the world's vaccines exports are concentrated in 10 countries. So Africa has 17% of the world's population, less than 2% of manufacturing facilities. So we need to decentralize manufacturing and scale up production.
Jim? The ability to do that sounds wonderfully easy in principle. And in practice, it's difficult in terms of physicality, but policy-wise, it's impossible.
You know, Richard, the thing that I want to remind everyone of is that we had a similar problem when we thought about treating people in Africa who were living with HIV. And you know, it's forgotten, but in the early 2000s, everyone was saying it's impossible, it's too expensive, the intellectual property issues will kill us. But we solved those issues. We can solve them for the vaccines as well.
Straightforward, simple question for a straightforward answer. Are we about to make the same mistake?
Yes, we're about to make the same. We're hearing all the same arguments that we heard back in the early 2000s when we solved that problem. President George Bush was really important in helping us to solve that problem. Here's what we need to do, Richard. We need to scale up manufacture of the mRNA vaccines. And we can do it while also protecting intellectual property. And really, it will be a windfall for the extraordinary companies who made these vaccines. But if we don't do it and do it quickly, we're going to be in trouble, because every single person who's infected is a mutation machine, right? And if the mutations go in a direction where the method of virulence, the spike protein, somehow changes, we're back to square one.
Akin, one assumes that the people making decisions are not mendacious murderers. Therefore, if you assume that, why are we in danger of making the same mistake again? Why can we not solve this problem? Why is the African Development Bank not able to help do that?
Well, you know, first is, let me agree with both Ngozi and Jim on this issue. I think the key is we have to have, you know, local manufacturing in Africa for sure. If you take a look today, only 1%, okay, of the vaccine production is actually done in Africa. So it's very, very small. When you take a look at the population of Africa, very, very high. Now, the key to being able to do that is that, vaccines are not just things you take off the shelf, right? You need to build up your R&D capacity significantly. So African countries have to boost the R&D investments that they are making significantly. Second is that we have to boost skills. The issue is not just simply having relocalization of foreign multinational companies producing vaccines in Africa. It is how we actually ensure that African indigenous pharmaceutical companies can actually have access to the technology. So in fact, IP is still important, but have the skills to be able to produce not just mRNA technology, but several others to deal with Africa's epidemiological disease profile. So of course, from the bank, African Development Bank,
hang on. I'm gonna jump in here. I'm jumping in here again because I feel a sort of natural frustration here because I've heard this for the last 18 months. Each one of you has told me we need to do this, we need to do that, but you are the policymakers.
So Richard, I'm no longer a policymaker, but here's what I would say. One of the issues right now, we went through a time when multilateral institutions fundamentally were questioned, their value, their role, and right now, where is the coalition that will bring together leaders of the multilateral organizations, private sector leaders, governmental leaders? Where is the coalition that will say, look, this is an unprecedented challenge. We've never had to do something for 7 billion people in the world. We now need to come up with solutions that are quite different. I think there are a lot of options on the table, but we need leadership. First and foremost, I think we need leadership from the traditional leaders like the U.S. government.
Okay. Can I come in?
Yes. Never mind about it.
Just to add to yes, I'm in a position, at least where some policies can be made and action. And we are taking action. It's not just talk. At the WTO, we actually reached out to the manufacturers of these vaccines. And we said, how can we work with you? And they said, we need help with our supply chains. Supply chains for vaccines are very complicated, spread across multiple countries. So we are helping them in that way by making sure their supply chains flow. They can scale up output and increase production. So we're not just talking about it, we're doing it.
So where's the problem?
The problem, there are several things. One, of raw materials sometimes.
Right.
Yeah, you know that the raw materials for vaccines are also used for other drugs like cancer drugs and so on. So right now, we're experiencing some shortages. Two, we have export restrictions and prohibitions sometimes that stop supply chains from flowing. We've got to lift all of that so that manufacturers can get their hands on what they need.
But to be very specific, for the mRNA vaccines, it's the fat globules that are the most important. And there's only one company making that now. And part of the reason there's only one company is, in fact, because of intellectual property. Now, again, I want to say it's so important to protect intellectual property, so important to make sure that Moderna, Pfizer, the others who have developed these vaccines are continue to be able to sell. But that one issue of the fat globules, it comes down to things like that, Richard. How do we increase the number of manufacturers for that? SM102 is what it's called.
All right. Akin, why this fat globules or the supply chain? Everybody's got supply chain issues. I understand the good work you're doing, Ngozi. But why have we got into this appalling position where 80% of the developed world has had one vaccine and 20% less than, and if we're talking some countries, probably in single digits, low single digits, have none?
Well, there's several. First, let me say on what you said earlier in terms of what we're doing. The African Development Bank is going to be investing $3 billion in supporting African indigenous pharmaceutical companies to be able to where these vaccines can be produced, and also dealing with the whole issue of quality control. You have to have infrastructure to deal with the whole issue of clinical trials and all of that. So infrastructure is important. The bank is investing in infrastructure, and we expect that Africa will probably need about another $23 billion of infrastructure investments to be able to get this done on the long term.
Jim, you're no longer in public office. You can be undiplomatic. I love what Akin's saying in terms of you need this, we need that, we need this, we need the other, we need long-term this. So what's stopping it? Where is the money coming? Is it the money? Is it the regulation? Is it the policymakers? Or, I suspect, a bit of all, along with a bit of incompetence, that because everybody...
Bear in New York. Our next panel is an interesting one, talking about building back healthier, a vision for the future. Talking about the world stage, equity, how health can be transmitted to different communities around the world in an equal way. Joining us here, Nomzamo Mbatha, actress and Goodwill ambassador, the UN Refugee Agency, and Professor Muhammad Yunus, 2006 Nobel laureate, founder of the Grayman Bank. Thank you very much for being here. You know, we were talking earlier about the issue of health across different communities, especially the refugee community, and what that means. It's such a massive issue around the world.
Absolutely. I mean, you look at the SDGs that the United Nations have, compelled the rest of the world to follow. We already were facing a lot of the social and economic financing gaps, or what we call at the UN donor fatigue. And donor fatigue was basically, most of the low income and middle income countries were the ones who are facing a $40 trillion infrastructure gap. So for me, we can't speak about the future without speaking about youth participation. And I think that's where we need to also focus on.
Professor, what actions do public and government entities, private sector leaders need to take to kind of ensure that we have the health systems that we need?
Well, the health system as it exists now is a dysfunctional system to begin with. And the COVID-19 has made it very clear. As it approached, as it came, with most of the public health system really collapsed. It didn't have anything to deal with. And there was no global guidance, global system which can help people to survive, protect themselves. And you mentioned about the healthier future. Sounds like a cruel joke when people are dying right now because of the vaccines. Pandemic has spread all over the world. But when the vaccine came, we're hoping that this will protect the life of the people around the world. But that's not how it happened. It went only to lucky 10 countries. 80% of all the vaccines went to the rich countries, the lucky 10 countries. And the rest of the world is with 20%. And the continent like Africa got about 2% of the people vaccinated so far. And if it continues like that, it will probably take 57 years to get the vaccinated done. So we don't see any future being healthier. It's getting worse. How many deaths are waiting? And the vaccines, they made the promise that they will not give it to anybody because they will want to make lots of money out of it. And the vaccines, we are trying to make it patent-free so that it could be available, it could be produced globally. That's not what they want. They want to protect it with the walls of intellectual property right. So we have the knowledge. The entire world has knowledge how to protect the life of the people. But the money-making businesses want to make sure they make the maximum out of it by protecting it to give it to the highest bidder. Forget about the millions of people who will be dying because of the vaccines. So that doesn't say that we will be healthier world. We're just approaching a massive number of deaths because we could not even manage our knowledge system. That the knowledge, we are not asking for money. The countries don't ask for money. They don't ask for free vaccines. All they want, they can produce those vaccines so that you remove that barrier, what you put with the intellectual property right.
But Professor, how do you change that dynamic? How does that dynamic shift?
It's very simple.
This is where
it's
we are accurately portrayed.
Yes, sure. Just to remove make a decision at the WTO in the TRIP conference, TRIP Council meeting, unanimous decision. All the countries of the world almost agreed right now. I think the meeting will be on 26th of September in New York at the UNGA General Assembly. Only countries is still Germany. It has to be a consensus resolution. Every country has to agree. Germany is sticking out. They don't agree. Every other country, including USA, Biden himself declared that they would join in the resolution to make a waiver of the intellectual property right. So this is what this is. One country is stopping make it available intellectual property right to remove temporarily, not permanently, so that every country has opportunity to produce it in their country so that this vaccine is available. So we have to bring lots of pressure to persuade countries who are still not signing up.
That is part of President Biden's speech here at the UN General Assembly, we're told. For the refugee issue and for different communities, there is this equity issue when it comes to vaccines and health particularly.
I mean, I think equity for the larger definition of it is just equal access. You know, we can't say that we're moving forward into a new world or building better or building healthier, as the Professor said, without actually having a larger conversation about the equal access to resources, the equal access to your vaccine, the equal access to quality education. And that won't happen only on government's shoulders, as we've seen. You know, good governance is needed, 100%, but we also need private sector. We need philanthropic funding. We need those who have the muscle, those who have the access and who have the ways to cast the net to be able to lift the lid of invisibility and truly make a change and walk the talk. Yeah.
There's a lot of people that don't, I don't think, fully understand the refugee problem. I mean, some countries obviously deal with it day to day, Jordan, for example, and others who have refugees in their country. But you are an ambassador, you acknowledge that this is a massive issue around the world.
Right. It absolutely is. You know, we speak about global climate, but one of the predecessors, or the things that actually, not predecessors, but the byproducts of climate change is human migration, forced human migration. People don't want to leave their home. Everybody wants to be home, right? You know, but unfortunately, because people want to, you know, we see that there's a lot of funding that goes towards climate change, but there's not a lot of funding that goes to human migration or forced human migration and the refugee crisis. The refugee crisis, we're looking at 80+ million people that are forcibly displaced. 80+. And so how do you change that narrative? And in changing the narrative, it's saying that, you know, refugees are not an economic burden. They're actually economic assets. But it's about unlocking that. And it's also about absolutely injecting the funds that are needed so that people can become sustainable in their own way.
Professor, as we wrap up here, are there lessons learned from COVID-19? And that prepare us for the next pandemic, the next health emergency around the world?
Yeah, we learned a lot during the pandemic, during this crisis that we have. First, we learned that although we promised ourselves multilateral solutions to the problems, we found out that we have no basis of multilateralism. We became isolated islands for ourselves. Everybody protecting themselves. That's why the whole idea of whole terminology of vaccine apartheid came. Everybody is trying to protect themselves. That's why every rich countries pouring in their money to get their vaccines out from the production channel. Others cannot get to it. They have excess vaccines available to them, but others are waiting in line, not getting the vaccines. So this is a lesson that we have to feel that all the things about talking about the global village, it really doesn't exist. We are all isolated islands, no matter what. When the time comes, this is where we go to. So we have to redesign the world completely. And this design, the world that we have created led to the terrible problems like global warming. Is a product of our own doing, what we have done. And IPCC report just told us that we have only 20 years left before 1.5 degrees Celsius heat temperature reached. And then we are at the point of no return after that. So it's only 2040, that's about it. And we are promising everything will happen by 2050. I hope 2040 we can avoid that. So this is one, global warming, and then there is extreme wealth concentration. All the wealth of the world is in the hands of few people, including in the United States. People don't have the wealth. Wealth is belonging to a small number of people in the United States. Similarly, in other countries also. It is, again, the net result of the economic system we built. So the wealth is away from the people, and people, bulk of the people, 99% of the people at the lower end of the income, they don't have the wealth. Wealth belongs to 1% of the population who are way up in the sky. All the wealth, 99% of the wealth there. So we have to redesign that system where wealth and the people will be living together, not separated out like the way it is done. And then we create the artificial intelligence, what we have. This is what we learned, that artificial intelligence will take away all our jobs, all our activities in the world. We become a garbage on this planet. So we need to design. So this opportunity COVID-19 pandemic gives us to reflect what the kind of world we have built, and we create a new world for us, a world of 3 zeros: zero net carbon emission, zero wealth concentration, and zero unemployment by unleashing the entrepreneurship among the people. That's the kind of thing we have to do. And there's a great lesson that you have done. And one conclusion that the pandemic gives us, no going back. We don't want to go back to the old world that we are coming from, which is a suicidal world. We are all going to commit suicide with the global warming, with wealth concentration, with massive unemployment created by the artificial intelligence. So we need to decide during this pause that given by the pandemic, this pause, we decide no more going back. We are going to get a new direction, a new destination for the world with the 3 zeros: zero wealth concentration, zero artificial intelligence, and zero net carbon emission.
I mean, that's fascinating. Obviously, huge to get there as in the world, and we're talking about some of those issues here at the UN General Assembly this week. Sure. But let's leave on something optimistic, which is this awareness has increased, right? And the problems that we're talking about at this forum and others does bring awareness to these issues.
Absolutely. And I think, just to touch on the point, we shouldn't look too much on where we were, right, on the world before. There's no way we're ever going back to that world again. It's about the progressive point of view that we need to have now. What does the future look like? This is why we're here. We want to know what the future is going to look like. We want to know what kind of participation does everyone need to have, from the healthcare, from the scientists, from the educators, from the activists as well, you know, even from the artists ourselves. You know, what are the narratives that we're going to be putting out? What are the social policies that are going to be changing? I think it's important for us to remain optimistic. We want to be here. We want to enjoy this beautiful planet. We want to enjoy this beautiful life that we have. We also want to be able to uplift those marginalized populations around the world. Again, it's not about looking back, it's about looking forward. And, you know, there's been a lot of groundwork that's been done. You know, there's a reason why FII Institute is hosting such an incredible and grand conversation. It's because they have equal participation. They are in the trenches. They want to build a better world. And as, you know, as it was conveyed at the G7 summit, you know, the B3W, build back better for the world. That's exactly what we're going to do. And maybe it's the optimist in me, but, you know.
Well, listen, you have a busy schedule. You have fun doing this?
Absolutely. I want to stay here the entire day. Can I stay?
Thank you very much. Professor, thank you very much. We're now going to bring on the man who runs, Richard Atias, to wrap us up here. Richard?
Thank you, Professor Yunus. Thank you for your loyalty. Thank you for your friendship. It's always good to see you. Thank you, Brett, for this great moderation. Thank you, Nomzamo, for your great word. I would like to rebound of what you said. Let's build the future together. I think it's a very good program. I like it. And how to build it? At the Institute, we would like definitely to make a call to all these innovators. This is your home. The FII Institute is your home. So please, all innovators, send us your project. We have an arm also, which is a call to action. We have an arm at the Institute which is called ACT. ACT is to invest also. We are ready to invest in some very innovative projects. And the way to invest is for a simple reason. We have one agenda at the FII Institute, and our agenda is humanity. And this is what we'll be talking about on the 26th, 27th, and 28th of October in Riyadh at the 5th anniversary of the FII. So please join us. We will talk about why we should invest in humanity if we want really to build a sustainable renaissance. This is very important. And last but not least, I would like to thank, of course, our chairman, the FII Institute chairman, His Excellency Yasir Al-Rumayyan. I would like to thank all our moderators, our great speakers, and last but not least, thanks to all of you. More than 4,000 people, more than 4,000 viewers today from 86 countries. Thank you, and we look forward to see you again very soon, end of October. Thank you all, and have a great afternoon, a great evening. Thank you.